If your doctor recently told you they're so proud of getting your blood pressure down to 118 over 76, what I'm about to share might save your life. Last month, a patient named Dorothy walked into my cardiology practice. She was 79 years old, and her primary care physician had just added a third blood pressure medication to her regimen. Her sitting blood pressure looked textbook perfect, 119 over 78. But Dorothy told me something that made my heart sink. She'd fallen twice in the past 6 weeks, once reaching for a coffee mug, once walking to her mailbox. "I just got dizzy," she said. "I thought it was just my age." It wasn't her age, it was her blood pressure medication. I'm Dr. Rebecca Monroe, and in my 23 years as a cardiologist specializing in geriatric cardiac care, I've seen this scenario play out hundreds of times. Well-meaning doctors following outdated guidelines, pushing blood pressure lower and lower in older adults, not realizing they're creating a different kind of danger. A danger that puts more seniors in the hospital than the high blood pressure itself. Here's what nobody's telling you. A groundbreaking study published in JAMA Internal Medicine tracked over 15,000 adults aged 75 and older for 5 years. The researchers wanted to answer a simple question: what blood pressure actually helps seniors live longest? What they discovered contradicts decades of medical teaching. Seniors whose blood pressure stayed between 130 and 145 systolic, that's the top number, lived longer than those who achieved that perfect 120 or below. But here's the part that shocked even me. Those with blood pressure below 120 had a 28% higher risk of serious falls requiring hospitalization. They experienced more kidney problems, more episodes of fainting, and their overall mortality rate was 14% higher than those with moderately elevated pressure. Let me be crystal clear about what this means. The blood pressure target your doctor is celebrating, the one that looks beautiful on your chart, might be silently stealing your independence. Because every time you stand up from your chair, walk to the bathroom at night, or reach for something on a high shelf, your blood pressure drops. And if it's already too low when you're sitting still, that drop when you stand can be catastrophic. Dorothy's story didn't end with those 2 falls. When I measured her blood pressure lying down, then immediately after standing, here's what I found. Lying down, 121 over 79. Standing up, 89 over 58. Her brain was being starved of blood flow every single time she stood up. She was walking through her days in a fog of inadequate oxygen to her brain, dizzy, unsteady, one fall away from a broken hip that could end her independence forever. We gradually reduced her medications. Today, her sitting blood pressure is 138 over 82. Her standing blood pressure is 128 over 76. She hasn't fallen once in 8 months. She told me last week, "Dr. Monroe, I feel like myself again. I didn't realize how foggy I'd been feeling until the fog lifted." This is what happens when we treat the patient, not just the numbers on a screen. Now, I need to tell you something important. The guidelines most doctors follow weren't designed for you. They were created based on studies of middle-aged adults, people in their 40 and 50, and then applied universally across all age groups. The assumption was simple. If lower blood pressure prevents heart attacks in a 50-year-old, it must be good for an 80-year-old too. But your cardiovascular system at 75 or 80 is fundamentally different from what it was at 50. Your arteries are stiffer. Your body's blood pressure regulation systems respond more slowly. Your kidneys process medications differently. These aren't signs of failure. They're natural adaptations to aging. And they mean that the same blood pressure target that protects a middle-aged person can actually harm an older adult. In the next several minutes, I'm going to walk you through exactly what the research shows, why your age matters more than your doctor might realize, and most importantly, what you can do about it. I'm going to teach you a simple 3-minute test you can do at home tonight that reveals whether your blood pressure medications are putting you at risk. And I'm going to give you the specific blood pressure ranges associated with the longest, healthiest survival for your age group. But before we go further, I need to know you're here with me. Drop a comment right now with just 2 things: your age, and if you've ever felt dizzy or lightheaded when standing up, add the word dizzy. I read every single comment, and what you share helps me understand what information you need most. This isn't just a video, it's a conversation, and your experience matters. Now, let me show you exactly what's happening inside your body, and why everything you thought you knew about blood pressure might need to change. Here's what's happening in doctors' offices right now, and why it's putting older adults at risk. A 76-year-old patient I'll call Margaret came to see me after her third fall in 4 months. Her medical record showed perfect blood pressure control, consistently between 118 and 122 systolic. Her primary care doctor had even sent her a congratulatory message through the patient portal celebrating her excellent numbers. But Margaret wasn't celebrating. She was terrified. She'd stopped going to her book club because she was afraid of falling in the parking lot. She'd given up her morning walks. She was losing her independence one fear at a time, and nobody could tell her why she kept getting dizzy. The problem isn't that doctors don't care. The problem is that conventional blood pressure management in older adults is based on a fundamental misunderstanding of what happens to your cardiovascular system as you age. Let me explain the 3 critical changes that make standard blood pressure targets potentially dangerous after age 70. First, arterial stiffening. By the time you reach your mid-70 seconds, your arteries have lost much of their elasticity. Think of it like this. A young person's arteries are like fresh rubber bands, flexible and responsive. Your arteries are more like leather belts, sturdy but far less elastic. This isn't disease. This is called arteriosclerosis, a natural part of aging. When your heart pumps blood into stiff arteries, they can't expand and absorb the pressure surge the way young, flexible arteries can. This means you actually need slightly higher baseline pressure to ensure adequate blood flow reaches your brain, especially when you're standing upright and blood has to fight gravity to get there. Second, your baroreceptors, those are tiny pressure sensors in your blood vessels, become less sensitive with age. In a younger person, these sensors detect a pressure drop within milliseconds when they stand up. They instantly signal the brain. Pressure dropping, increase heart rate, constrict blood vessels. The response is automatic and nearly instantaneous. But after age 70, these baroreceptors respond more slowly. It's like having a smoke detector with aging batteries. It still works, but the delay between detecting the problem and sounding the alarm grows longer. If your baseline blood pressure is already low and your baroreceptors are slow to respond, you get that dangerous drop in pressure when you stand. That's called orthostatic hypotension, and it's what was happening to both Dorothy and Margaret. Third, medication metabolism changes dramatically. Your liver and kidneys don't process and eliminate medications as efficiently at 75 as they did at 45. A standard dose of blood pressure medication that's perfectly safe for a middle-aged adult can accumulate in an older person's system, creating effects that are too strong and last too long. The medication that brings a 50-year-old's pressure from 160 to 130 might push a 78-year-old's pressure from 145 to 105, and that's where the real danger begins. Now, let me show you what the research actually reveals. The JAMA Internal Medicine study I mentioned earlier didn't just track numbers, it tracked real outcomes in real people. The researchers followed 15,342 adults over age 75 for an average of 5 years. These weren't cherry-picked healthy seniors. These were everyday older adults with diabetes, prior heart attacks, kidney disease, arthritis, the full spectrum of conditions you and your friends are managing. The researchers divided them into groups based on their average systolic blood pressure, below 120, between 120 to 130, between 130 to 140, between 140 to 150, and above 150. Then they tracked who lived longest, who stayed out of the hospital, who maintained their independence, and who had the fewest complications. The results should have changed medical practice overnight. The group with the lowest mortality rate, the group that lived longest and healthiest, had systolic blood pressure between 130 and 140. Not below 120, not the perfect textbook number, the moderate range. Those with pressure below 120 had a 28% increased risk of falls requiring hospitalization. They experienced higher rates of acute kidney injury, their kidneys couldn't function properly with the lower pressure, they had more episodes of syncope, that's the medical term for fainting, and their overall mortality rate was 14% higher than those in that 130 to 140 sweet spot. This isn't a small difference. This isn't statistical noise. This is a substantial, clinically meaningful finding that directly contradicts what most doctors are still being taught to do. If this information is opening your eyes to risks you didn't know existed, I need you to do 2 things right now. First, subscribe to this channel and turn on notifications. I publish videos every week bringing you research-based information about senior health that your doctor might not have time to explain. Second, comment below with the word aware if you or someone you love is on blood pressure medication and over 70. I want to see how many people this affects, because awareness is the first step toward protecting yourself. Margaret's story, by the way, has a good ending. But to understand why, you need to know exactly what we did differently, and that's what I'm going to show you next. Let me tell you what happened when we changed Margaret's treatment approach. Instead of celebrating that perfect 118 over 76, we did something her previous doctor never thought to do. We measured her blood pressure in 3 positions: lying down, sitting, and standing. We waited 2 minutes between each measurement, and what we found changed everything. Lying down, 125 over 78. Sitting, 118 over 76. Standing, 94 over 62. Her brain was losing critical blood flow every single time she stood up. No wonder she was dizzy. No wonder she was falling. Her body was literally being starved of oxygen with every position change. Here's what I need you to understand. The solution isn't complicated, but it requires throwing out the one-size-fits-all approach that's dominating medical practice right now. What we did for Margaret, and what I've done successfully for hundreds of patients over 70, is based on a framework I call the right range protocol. And the key word here isn't low, it's right. The right range protocol starts with a simple truth. Your optimal blood pressure isn't determined by general guidelines written for 50-year-olds. It's determined by 3 factors specific to you: your age, your postural blood pressure response, that's how much your pressure drops when you stand, and your individual health history. When we account for all 3, we discover that the target range for most adults over 75 is significantly different from what conventional medicine prescribes. Based on the JAMA Internal Medicine study and subsequent research from the European Society of Hypertension, here's what the evidence actually shows. For adults aged 70-79 inches, generally good health, the optimal systolic blood pressure range, that top number, is 130 to 145, not below 120. For adults 80 and older, the range extends even higher. 135 to 150 systolic is associated with the best outcomes, the longest survival, the fewest falls, and the best quality of life. Now I can hear some of you thinking, but Dr. Monroe, my doctor said anything over 130 puts me at risk for stroke and heart attack. And here's where we need to separate fear from facts. Yes, uncontrolled high blood pressure is dangerous, but we're not talking about uncontrolled pressure. We're talking about the difference between 120 and 138. That 18-point difference isn't putting you at increased risk for cardiovascular events. What it's doing is ensuring adequate blood flow to your brain when you're standing, walking, and living your life. The landmark SPRINT trial, which many doctors cite when pushing for lower targets, actually excluded adults over 80. It excluded people with diabetes. It excluded people with prior strokes. In other words, it excluded most of the seniors sitting in doctors' offices being told to get their pressure below 120. The research that actually included older adults with real-world health conditions tells a completely different story. Here's the protocol I use with every patient over 70. First, we measure blood pressure in all 3 positions: lying, sitting, and standing. If the standing pressure drops more than 20 points systolic from the sitting measurement, that's a red flag. It tells me the current medication regimen is too aggressive. Second, we identify what I call the symptom threshold. That's the blood pressure level where you start experiencing dizziness, fatigue, or mental fog. This is why your input is so critical. I want you to do something right now. Think about how you feel when your blood pressure reads 120 over 80 or lower. Do you feel energetic and clear-headed? Or do you feel slightly off, maybe dizzy when you stand, maybe more tired than usual, maybe just not quite yourself? Write it down in the comment section below. Tell me your age and describe exactly how you feel at those perfect numbers. This isn't just curiosity. Your experience is data, and it matters more than any number on a screen. Third, we adjust medications gradually, reducing doses or eliminating medications one at a time while monitoring both sitting and standing pressures. The goal isn't to stop all blood pressure medication. For many people, some medication is beneficial and necessary. The goal is to find your right range, the sweet spot where your sitting pressure is adequately controlled, but your standing pressure doesn't drop into dangerous territory. Margaret's final regimen was half the medication she'd been taking. Her sitting pressure stabilized at 136/81. Her standing pressure stayed at 124/76. She stopped falling. The brain fog lifted. She went back to her book club and started walking again. 6 months later, she told me, "I feel 10 years younger." I didn't realize how much those medications were stealing from me. This is what's possible when we treat the person, not the protocol. But here's what you need to know. This approach requires your active participation. You need to know your numbers in different positions. You need to track how you feel. You need to advocate for yourself with your doctor. Before I show you the exact steps to take this week, write in the comments your current blood pressure medication, your age, and whether you've experienced any dizziness in the past month. Write it down now. This creates accountability, and accountability drives action. Now let me walk you through exactly what you need to do this week to protect yourself or someone you love. This isn't theory anymore. This is your action plan, and I'm going to make it so simple that you can start today, right after you finish watching this video. Step 1, the 3-position test. You can do this at home with an inexpensive blood pressure monitor. Here's exactly how. First thing in the morning, before you've had coffee or breakfast, lie flat on your back for 5 minutes. Just rest. Let your body completely relax. Then take your blood pressure while still lying down. Write down both numbers. Now sit up slowly, wait 2 full minutes, and take your pressure again while sitting. Write those numbers down. Finally, stand up, wait 2 minutes, and take your pressure while standing. Write those numbers down. What you're looking for is the delta, the difference between your sitting and standing pressure. If your systolic pressure, that top number, drops more than 20 points from sitting to standing, you need to have a conversation with your doctor. That's not normal aging. That's orthostatic hypotension, and it means your current medication regimen needs adjustment. If it drops more than 30 points, this is urgent. Don't wait for your next scheduled appointment. Call your doctor this week. Step 2, the symptom journal. For the next 7 days, I want you to track 3 things. Your blood pressure readings at different times of day, how you feel physically, be specific about energy levels, dizziness, mental clarity, and any near falls or balance issues. This journal becomes your evidence. When you walk into your doctor's office and say, "My pressure is 118/75, but I'm dizzy every time I stand up. And here's my week of documented readings showing a 35-point drop when I stand." You're no longer just complaining. You're presenting data that demands attention. Step 3, the doctor conversation. This is where many of my patients feel intimidated, and I understand why. You don't want to seem like you're questioning your doctor's expertise. But here's what I tell every patient. Your doctor is managing dozens or hundreds of patients. You are managing one, yourself. You are the expert on how you feel, and that expertise matters. Here's the script I give my patients. "Doctor, I've been tracking my blood pressure in different positions, and I'm seeing significant drops when I stand. I'm also experiencing dizziness, and I'm concerned about fall risk. I've read recent research suggesting that for adults over 75, slightly higher blood pressure targets between 130 and 145 may actually improve outcomes and reduce fall risk. Can we discuss whether my current target is appropriate for my age and symptoms?" Notice what this does. You're not saying your doctor is wrong. You're presenting your experience, referencing current research, and asking for a discussion. Most doctors will respect this approach, especially when you come prepared with documented readings. Step 4, the medication review. If you're taking multiple blood pressure medications, ask your doctor this specific question. Which of these medications could we consider reducing first while monitoring my response? Often, one medication can be reduced or eliminated without compromising overall pressure control, but with significant improvement in how you feel. Now, here's something I need you to hear, and I'm saying this as someone who genuinely cares about your well-being. If you've made it this far in this video, you clearly care about your health. You're the kind of person who doesn't just accept what they're told, you investigate, you learn, you take action, and that matters more than you might realize. But here's the thing. This video took me weeks to research and prepare because I wanted to give you information that could genuinely change your life or save it. And tomorrow, YouTube's algorithm might never show you my content again. You might forget this channel exists. And 6 months from now, when you need information about managing diabetes as a senior, or understanding new cholesterol guidelines, or knowing which supplements actually have evidence behind them, you won't know where to find trustworthy, research-based information designed specifically for your age group. I don't want that to happen. I publish videos every single week covering topics that directly impact your health, your independence, and your quality of life. Information your doctor might not have time to explain in a 15-minute appointment. Research findings that could change how you manage your health. Practical protocols you can implement immediately. So I'm asking you, as someone who clearly values your health enough to watch a 20-minute video about blood pressure, please hit that subscribe button right now. Not for me, for you. For the version of yourself 6 months from now who needs reliable information and won't remember where to find it. Subscribe so you don't miss the information that could prevent your next health crisis. You deserve to have this resource readily available. Don't let the algorithm decide whether you get to access it. And turn on notifications. Because some videos I publish contain time-sensitive information, like when new research comes out that contradicts current practice, or when there's a medication recall you need to know about immediately. Let me bring this full circle and tell you what happened with Dorothy, the patient I told you about at the very beginning. Remember, she came to me after falling 3 times, terrified of losing her independence, with a blood pressure her previous doctor called perfect, at 115/72. We did the 3-position test. Her standing pressure was 89/58. We reduced her medication by half, adjusted her protocol to target 135 to 140 systolic, and monitored her carefully over 8 weeks. Her final stable range, 138/79 sitting, 126/74 standing. The dizziness disappeared completely. She hasn't fallen once in the 14 months since we made that change. Last month, she sent me a photo of herself hiking with her grandchildren, something she thought she'd never do again. That's not a miracle. That's what happens when we apply the right research to the right patient at the right time. And that's exactly what I want for you or your loved one. But here's what I need you to understand about where we are right now in medicine. The guidelines are changing, but they're changing slowly. The research I've shared with you today, the JAMA Internal Medicine study, the European Society of Hypertension findings, the outcomes data from thousands of seniors, this information exists. It's published, it's peer-reviewed, but it hasn't filtered down to every doctor's office yet. Some physicians are still operating on guidelines from 2017 that don't account for the nuances of aging physiology. This isn't about blaming doctors. Your physician is doing the best they can with the information they have and the 15 minutes they're given to see you. But you cannot afford to wait for the system to catch up. You cannot afford to be passive about your own health management. The cost of waiting is measured in falls, fractures, loss of independence, and shortened lifespan. So here's what I need you to commit to doing in the next 72 hours. Not next week, not when you get around to it. In the next 3 days. First, order a home blood pressure monitor if you don't already have one. You can get a reliable one for under $30. I'm not affiliated with any company. I have no financial interest in this, but you need the ability to monitor your pressure at home in different positions. Your doctor's office can't capture what happens when you stand up at home after sleeping or after sitting for an hour watching television. You need that data. Second, do the 3-position test I described in the last section. Morning is best, before coffee, before breakfast, when your body's natural rhythms give you the most accurate baseline. Lie down for 5 minutes, take your pressure, sit for 2 minutes, take your pressure, stand for 2 minutes, take your pressure. Write all 3 readings down with the date and time. This is your evidence. Third, start the 7-day symptom journal. Blood pressure readings, how you feel, any dizziness or lightheadedness, any near falls or balance problems, your energy level, your mental clarity. Be specific. Felt fine isn't helpful. Felt dizzy for about 30 seconds when I stood up from the dinner table. Had to grab the chair to steady myself. Is exactly what you need to document. Fourth, schedule an appointment with your doctor specifically to discuss your blood pressure management. Don't try to squeeze this into an appointment about something else. This deserves focused attention. When you call to schedule, tell them you want to discuss your blood pressure targets and medication regimen because you've been experiencing symptoms. That gets it on the agenda. Fifth, and this is critical, bring an advocate with you to that appointment. A spouse, an adult child, a friend, someone who can take notes and help you remember what's discussed. When you're anxious or feeling dismissed, it's easy to forget important details. Having someone else there changes the dynamic and ensures nothing gets missed. Now, I want to address something directly. Some of you watching this are thinking, this applies to my mom, or this sounds like my dad, or my spouse needs to hear this. You're watching this for someone else, not for yourself. And you're wondering how to bring this up without seeming like you're interfering or being alarmist. Here's what you do. Send them this video. Don't summarize it. Don't try to explain it. Just send the link with a message that says, I watched this and thought of you. Would you watch it and let me know what you think? Then, after they've watched it, offer to help them with the 3-position test. Offer to go to their next doctor's appointment with them. Offer to be their advocate. Sometimes the most loving thing you can do is provide information and support without judgment. Before we finish, I need you to do 3 more things right now, while this information is fresh and before you close this video and move on with your day. First, comment below with your commitment. Right, I commit to doing the 3-position test this week. That's it. Simple, specific, public commitment. Research shows that publicly stating your intention increases follow-through by over 60%. Write it down. Make yourself accountable. Second, if you haven't subscribed yet, do it now. I know I already asked earlier in this video, but this is your last chance to make sure you don't lose access to this resource. Every week, I publish new content about senior health, medication management, new research findings, practical protocols you won't hear about anywhere else. You've invested 25 minutes watching this video. Don't let that investment be wasted because you forgot where to find this channel when you need it again. Hit subscribe. Turn on notifications. Do it for the version of yourself who will need this information in the future. Third, share this video. I don't ask this lightly. I'm not trying to go viral or build an empire, but I guarantee you know someone who needs this information. A parent, a neighbor, someone at church, a friend from your book club, someone over 70 who's on blood pressure medication and might be at risk. Sharing this video could literally save their life or prevent a fall that changes everything. Click the share button. Send it to 3 people who need to see this. You might be the reason they avoid a catastrophic outcome. Here's my final message, and I mean this with everything in me. You deserve to live your later years with vitality, independence, and confidence. You deserve to walk without fear of falling. You deserve to think clearly and feel energized. You deserve medical care that treats you as an individual, not a number on a guideline chart. The information in this video gives you the power to advocate for that care. Use it. Don't be passive. Don't accept that's just part of getting older as an answer when there are evidence-based solutions available. Your health, your independence, your quality of life, they're worth fighting for. Thank you for trusting me with your time today. Thank you for being the kind of person who seeks knowledge and takes action. Stay informed, stay empowered, and I'll see you in the next video. And one more thing, please remember this video is for educational purposes only and is not a substitute for professional medical advice. Always consult with your healthcare provider before making any changes to your medication regimen. Your doctor knows your complete medical history and is your partner in managing your health. Use this information to have informed conversations, not to make unilateral decisions. Remember Dorothy from the beginning? She took action, and her life changed. Now it's your turn. I'm Dr. Monroe, and this channel is your resource for research-based health information whenever you need it. New answers are here regularly. You choose which ones matter to you and when you watch them. Until we meet again, stay informed, stay empowered, and take care of yourself.